Good afternoon and welcome back to GP Video Podcast by Nadia. So yesterday we started talking about Mounjaro and Wegovy or Ozempic, and today we'll continue talking about them. So Mounjaro and Wegovy or Ozempic are injectable medications that help control blood sugar levels in patients with type 2 diabetes. Both medications have quickly become very popular thanks to their weight loss effects. While Mounjaro and Wegovy or Ozempic offer similar benefits, there are key differences that set both medications apart. So both of them are used in people with type 2 diabetes to lower their blood sugar levels, but both of them are also used for weight loss, and both of them are excellent medications, excellent injectables, once a week injectables, but there are some key differences between both of them. So I just thought that I should let you guys know. But people who suffer from obesity and are there to lose their weight, are determined to lose their weight, both of the medications are very nice, but if you are going to choose any one of them, you should know what the difference is. But you should go for any one of them for sure. Talk to your GP about it. Okay, so Mounjaro is a dual-acting GIP and GLP-1 receptor agonist. What does GIP stand for? GIP stands for glucose-dependent insulinotropic polypeptide, and GLP-1 means glucagon-like peptide 1. So Mounjaro is a dual-acting GIP and GLP-1 receptor agonist. It is the first and only drug of its kind mimicking the effects of both hormones. Ozempic or Wegovy or semaglutide, on the other hand, is only a GLP-1 receptor agonist, which is glucagon-like peptide receptor agonist. So what is GLP-1? Glucagon-like peptide, because both Mounjaro and Ozempic, they are GLP-1 receptor agonists. So glucagon-like peptide 1 or GLP-1 is a hormone that has multiple functions in the body, including number 1, insulin secretion. So GLP-1 triggers the pancreas to release insulin, which helps the body use food for energy and lowers blood sugar levels. So number 1 is GLP-1 increases the insulin secretion in the body. Number 2, GLP-1 prevents the body from releasing glucagon, which raises blood sugar levels. So it helps increase the insulin levels and helps decrease the glucagon levels. What does insulin do? Insulin lowers the blood sugar levels while glucagon increases the blood sugar levels. So GLP-1 increases insulin levels, so lowering the blood sugar levels, and decreases glucagon levels, again lowering the blood sugar levels. Okay. Number 3 is digestion. GLP-1 slows down stomach emptying, which means the body absorbs less sugar from food. Then, so the lower the stomach emptying is, the lower the amount of food that is absorbed from the gut. Then, GLP-1 affects the brain's hunger and satiety centers, making you feel full after eating. So the lower the stomach emptying, the more the signals go to the brain that you are full, and then when you were eating, you were going to eat a full pizza, now you eat just a piece of pizza and one piece of pizza and you are full. Now, yesterday in my podcast, I said that GLP-1 does not affect on the brain directly, but it only acts indirectly. But there are opposing views about it. They say that there are GLP-1 receptors in the brain's hypothalamus and brainstem, and these are the ones that are located in the appetite center. And activating these receptors in the brain's hypothalamus and brainstem reduces food intake and promotes weight loss. Anyways, if GLP-1 receptors are gonna affect the brain directly or indirectly, doesn't matter, but they do affect on brain, and then in this way the appetite is reduced. So there could be receptors in the brain, the GLP-1 receptors in the brain, that are activated and the appetite is reduced, or through the slowed gastric emptying, the signals go to the brain that, we are full, and then we don't feel hunger anymore. So it could be both the mechanisms together, or it could be any, I think it's both of them, because there are opposing waves, but then it's both. So the gastric slowing is reduced, so the signals go to the brain that we are full, so that's why we don't feel hungry anymore. Or there are GLP-1 receptor agonists in the brain itself, where they are activated, and then again the appetite center is a signal that we are not hungry. So that's the thing. So these are all the mechanisms of GLP-1, and that's how GLP-1 or glucagon-like peptide 1 receptors work. So GLP-1 medications can also be used to reduce the risk of heart attack, stroke, and death from heart disease. Now, effectiveness. Mounjaro is more effective than Ozempic for both blood sugar control and weight loss. In clinical trials, 80% of people who took Mounjaro lost at least 5% of their body weight, and 36% lost more than 15% of their body weight. Of those who took Ozempic, 54% of participants lost at least 5% of their body weight, while 8% lost more than 15%. Mounjaro also resulted in more significant reductions in HbA1c, a measure of long-term blood sugar levels. So, now, what is the difference again? Ozempic is approved for people with type 2 diabetes and cardiovascular or heart disease to help reduce the risk of major cardiovascular events like heart attack, stroke, and death. Mounjaro is not currently approved for this use, though research shows that it also helps lower blood pressure, which may help lower the risk of heart complications. So while Mounjaro is better than Ozempic in weight loss and lowering the blood sugar levels and HbA1c levels, Ozempic is also approved for people with type 2 diabetes and cardiovascular complications. So that's the superiority of Ozempic over Mounjaro. When we talk about cost, on average, Mounjaro is more expensive than Ozempic. We'll come back to it because whenever I try and make a small video, it never happens. So we'll come back to it tomorrow.